So now we are going to be asking for representatives of our, two of our OCCI member organizations to speak. And we'll be hearing from representatives of the Barbara Schleifer Clinic and Access Alliance. First, we have Maricela Lozano, and she has been working with Barbara Schleifer Clinic since 2001 in Language Interpreter Services, a program funded by the Ministry of Citizenship. So speaking of government level support, there's an example of something that we can leverage and just keep moving that forward. And like you said, Diana, we need advocates for moving the policy forward. Back to Maricela, drawing on insights from her current role as administrative coordinator, she was speaking to us today about a very important group of OCCI stakeholders, the end users, and in particular, individuals with limited English or French proficiency. So, Maricela?
Thank you, Grace. Good afternoon, everyone. On behalf of the Barbara Schleifer Clinic, congratulations and all the best in developing an accreditation process that will work for everyone. For interpreters, but for most of all, the limited English speakers I'm here to talk about. At BSCC, we are in a unique place as we work alongside lawyers and counselors and their clients, more than 50% of whom are immigrant women or refugee women who often need the assistance of language interpreters. After 14 years at Barbara Schleifer, I know my colleagues and are convinced that they cannot do their work without interpreters. Since it is not as easy to get direct comments from clients, I asked our counselors and lawyers to provide me with some of the clients' comments and experiences. Here are some stories of two of our counselors. One is a Colombian client in Ontario for many years, but isolated by her abusive partner. Did not have opportunity to learn English. She was denied services because she's not a newcomer. With the help of our interpreters, she was able to explain why she needs ESL classes, receive OW, and other support. Separated from her partner for years, she was able to articulate why she's still in a lot of danger. Finally, he was arrested after her video statement, and now there is a non-contact order that he's following. The other is the story of a client who speaks very little to no English. Survivor of violence, currently going through the immigration system. Client had a medical crisis and phoned me from the emergency room. I could not understand what was going on other than she was in the emergency room and wanted to talk to me. I requested a conference call, and within a few minutes, a BAW trained language interpreter was able to help us to communicate. We spoke for a good hour and a half. She explained what's going on, her fears and her concerns. Through the language interpreter, I heard the client's voice and what she needed to feel supported. Through the language interpreter, client heard my voice. She was able to receive the validation she needed and to know that the clinic is here to support her. More importantly, she was able to know how to take care of herself, to get through her ordeal. In the end, she said, "Thank you for hearing and supporting me. I feel like I can get through this simply by having you on the phone." The language interpreter allowed client voice to be heard and validated. Here are words from a refugee law practitioner who uses our service. I had a convention refugee client who was at first hesitant to share all the painful details of her story. However, the presence of the language interpreter made my client feel more at ease, confident that the details and nuances of her story will be fully conveyed. The client demonstrated increasing level of openness with me as her counsel, as it became clear to her that the interpreter was communicating her story in a clear and accurate manner. Without the interpreter, I would not have obtained such an accurate accounting of my client's fears. My client felt comfort sharing her story trusting that everything will be kept confidential. The accuracy of the interpretation was further demonstrated at the refugee hearing, when the client's story remained consistent and her claim was granted. Now, my client is protected person in Canada, due in no small part all the important work of the professional language interpreter. In addition to above, our ED at the Schlaffer Clinic receives letters of gratitude from clients from language interpreter services. Once, she was approached by a Russian woman after attending a group session and said, for the first time in many, many years, she was able to talk about the abuse she suffered with the help of her interpreter. We also had a client who thought she spoke English, said, my ex is a doctor, rich and popular in our community. In my attempt at hearings to defend myself, it is automatic for me to speak in my native language. That is why I need an interpreter. It has been a pleasure to speak with you briefly about our clients who have limited English abilities. We hope you will continue to call us and use our access to limited English speakers as you move along your process to develop OCCI and the ACA. Thank you.
Thank you, Maricela. It's always a fabulous and important reminder to remember that we are ultimately accountable to someone's message. And the work that we're doing here just makes sure that we have it entrenched in the work that we do. And so next, I'd like to ask Axelle Janczur to come up and speak with us. Axelle is the Executive Director of Access Alliance Multicultural Health and Community Services. Axelle has been working in the not-for-profit sector in Toronto for over 25 years. Over her career, she has focused on addressing systemic barriers to accessing services faced by vulnerable populations, addressing service standards and quality issues, as well as capacity building in priority communities. Most recently, in her role as ED at Access Alliance, some of her accomplishments include advocating for improved access to the determinants of health for individuals and communities facing discrimination and marginalization, and developing a community-based research agenda. Thank you, Axelle.
So thank you very much for inviting me to be here today. I just have some remarks. We're all very busy, and at first I was like, oh, I can't go. I haven't been involved in the OCCI. I worked for the last year and a half, 2 years. Grace, thank God, stepped up and has represented Access Alliance incredibly well. And I was busy, and I thought, oh, I can't. Grace is going to go. And then I thought, what am I, nuts? I have to be here today because this, and it's so fun to see so many faces of my colleagues from over the years here today, because this is truly the common, and I'm not talking 5 years, I'm not talking 10 years, I'm not talking 15 years, I'm talking 20 plus years, that we have been working on professionalizing community interpretation. For me as somebody who works in the community services sector, Access Alliance and previous organizations that I worked in, because my work in community interpreting certainly transcended the organizations that I've worked in, we've always been about systemic change. We know that immigrants and refugees face barriers. Canada's a great place, but they face barriers accessing services, accessing high-quality services, and that's why we're in this work. That's why we're in this work. So a lot of people today have reminded us of how important it is to stay focused. And sometimes we didn't know what we were doing because, OCCI, the first organization in the world to do this, the national standards. I mean, we were a cheeky bunch. We developed these standards and we said, oh, you know what? They're national. And, there was uptake. There was uptake. There was obviously a gap and a need out there, but we didn't know what we were doing. There was this was all new territory. And we just, because of our commitment to the values of this work, knowing that people deserved access to service, that they deserve to have a voice, that they deserve to have the same quality of services as English or French speakers. That's why all of us are here today. I remember, so I don't know, it was well over 20 years ago, I was at a Critical Link conference, and I think it might have been the first conference up in Collingwood, and I was invited, and I was just a pipsqueak. I was invited to be a speaker against an Australian professor, because you know the Australians were always ahead of us, and it was like not a panel, but we were like debating each other, and it was community interpreter, advocate or adjunct. So adjunct is this vision of a little black box, right? You put the message in, you put the message out. Or advocate, so of course I was the advocate proponent, and this university professor from Australia was the adjunct proponent. Now, it was scary, but it was a lot of fun. We've come a long way since then. Our perceptions, our understanding of the role and what it takes have come a long way. We've refined them. And I think what we have today, our understanding of the sector today, our understanding of the role of interpreters, our understanding of the role of interpreter services providers has really evolved a lot. It's been a huge, huge amount of work. And, you know, the OCCI, as Paul said, is just the tip of the iceberg. I mean, over the years, we have done research papers, we have done literature reviews, we have done demonstration projects, we have done risk assessment frameworks, we have done processes to identify the competencies required for interpretation. Then we've developed and pilot tested and refined training curriculum, and then specialized modules of training curriculum. We've developed competency assessments and the you know, ILSATs and the CILSATs. We've done so many professional development sessions. We've had roundtable meetings and stakeholder meetings and meetings with MPs and meeting with MPPs. We've had, I remember one time when we've written position papers. One time I spent like a whole winter going around and meeting with all the health regulatory colleges to talk to the physiotherapists and the psychologists and the psychotherapists and the doctors and the dietitians about why they needed to support our position paper, why they needed to commit to working with, you know, professional, trained, tested interpreters, all of this promotion work. I mean, and we were all doing this, social marketing campaigns, employment fairs, conferences. I mean, it has been, somebody should write a book. We need to do that, some kind of, you know, photo voice journal of all of this work. And honestly, I mean, Lizette mentioned a little, and all of us, you know, we've been in different jobs, we've been moving around, and all of us have been working like off the side of our desk and late nights, and, you know, Lizette mentioned a little bit of money, but there was very little money. Like, there was no money, actually. And you could tell by the quality of snacks at our meetings sometimes, you know, like really sometimes it was just water. Or there's a second cup in the building, bring your own coffee. Because, you know, we had no money, but we published standards, we published curriculums, we published position papers. So it really, really was, it's been an amazing journey. What I was starting to say earlier was, so, you know, I've been involved in systems change work all my professional career, as so many of you have. And honestly, there are few examples where you really achieve systemic change. And I can count on one hand, you know, where I have been personally involved in systemic change. And this is an amazing example of system change. And I think we all should give ourselves a big, big hand. Because it's an amazing achievement. I just want to say, you know, we've, a lot of us around the room, again, I'm not going to name names because I'll forget some people, but you all know who you are, the oldies. You know, the wonder gals and guys, the grandmas. I'm not a grandma yet, I'm a great aunt. You know, honestly, and then new people as they come on board, like I was just watching, like I remember when I met Sohaila years ago, she actually came to give me heck as that we were a language. So Access Alliance, we're a community health center, but we also have an interpretation program, as many of you know. And so Sohaila wanted to come and meet with me to basically give me heck. You know, she thought we could be doing a lot better in terms of how we're paying and how we're treating our employers, our interpreters. So, you know, so you have a great advocate there, but you know, we have achieved systemic change, we've all changed and evolved, our positions have evolved. we're stronger, we're smarter, and it was very political too. I mean, everybody's used the word harmonious today. Well, there were times when it wasn't very harmonious at all. Lots of disagreements. Lots of disagreements. Oh, I can't tell you, we had some meetings, it was fractious meetings. Some of the emails, am I right, Paul? Some of the emails that we exchanged. But you know what, it was great because we challenged each other. We were very, very hard on each other. Nobody could get away with anything. And if anybody disagreed or felt you weren't stepping up, you know, we would call each other on it, and that forced us to be honest, to really talk through the issues and to hold ourselves to the highest standard. So it really was very, very positive. I just have a couple of stories. My entrance into the world of interpreting, when I was 18 years old, I was a newcomer to Toronto. I was studying at York, and I had been living in Spain with my family, so I started doing volunteer work as an interpreter in an immigrant settlement agency. So at the age of 18, with no training, no orientation, no nothing, I was sent to do home visits with welfare workers in the day, some of you might remember, in the day when they did home visits. And that was my trial by fire. I mean, I hate to think of what the hell I was doing. And then another story I have was the LITP program in the colleges. That just didn't appear one day and the colleges were delivering. That was years and years of work. I remember being on a committee that met for years and, you know, figuring it out and making agreements on curriculum and, you know, building it on the good work that had been done in Vancouver and done in Ottawa. And I spent 2 Saturdays, and this was before I drove, at Centennial College, because Centennial College was the first college in Toronto to try and run interpretation training. I spent 2 Saturdays with the poor director of the program. There were orientation meetings for people interested. Nobody came. We spent 2 Saturdays in a row up in Scarborough, I can't remember where it is anymore, trying to promote the program. So again, that didn't work. We went back to the drawing board. What do we need to do? How do we need to rethink it? So it's really been, it's been a journey for all of us. I think this is an amazing outcome. There is still work to do. It's for the right reasons. There's nothing more satisfying or fulfilling than participating in values-based work. We're all very committed to the values here. That's what got us through all the hard times, all the disagreements, all the challenges. And a big, you know, my heartfelt thank you to everybody. And let's keep on in this important work. And people have talked about the Syrian refugees today a few times, and the reality is we're in a much better place than we were when the Cambodian, Laotians, and Vietnamese came. We have trained interpreters. We have awareness. If you look at all the RFPs for service, they're talking about trained, tested, all the language. I mean, we've changed the language. We've changed the understanding of the role of interpretation. So, you know, for all you Arabic and other dialect speaking folks, certainly there's, this is again another opportunity to be able to step up and participate in a moment in time when interpretation is going to be critical for the well-being of so many vulnerable people who are coming to Canada. So thanks so much for inviting me, and keep up the good work, and hopefully I'll be around to see more and more success. So thank you all.